Hello students, I am Abhinash, nursing tutor, Chitkara University College of Nursing, and welcome to my nursing education channel. And today we are going to discuss about endotracheal tube. What is endotracheal tube, and what are its different type, different parts, and why we use the endotracheal tube. So let's start. So endotracheal tube. So first is a flexible plastic tube that is placed through the mouth into the trachea. So it is a flexible tube that is made up of plastic and transparent, so that we can see it is properly cleaned or not, or it is not it is blocked or not, and it is placed through the mouth. So it is placed through the mouth of the patient and placed into the trachea of the patient. Trachea is mainly a windpipe, so it is placed in a windpipe to exchange of air entry. And the process of inserting the tube is called endotracheal intubation. The procedure be done to inserting the tube is that procedure is known as the endotracheal intubation. Next is, what is the need of ET tube intubation? So when the patient is unable to breathe on their own, if the patient is not able to breathe their own, if the patient has a chest trauma or any other condition, any allergic, severe allergic reaction, or asthma, or any disease related to the lungs, so in those conditions we need to intubate the patient and to provide the mechanical ventilation of the patient to the patient. And when it is necessary to sedate the patient, if the patient we have to sedate the patient, so in that condition we need to intubate the patient so that we can provide the mechanical ventilation to the patient. As some who is critically the patient who is critical ill, if the patient is critically ill, so in this in that situation we have to protect the airway and provide the mechanical or external support, external respiratory support to a patient. So this is a need of intubation. In those conditions we have to intubate the patient and provide mechanical respirations or mechanical ventilation to the patient. So next is a part of ET tube. What are main parts of ET tube? So ET tube is divided into three main parts. First is a proximal end. The proximal end is about 15 centimeter in diameter. So this is the 15 centimeter in diameter. So this is the standard size of proximal end, so that it can connect easily to the ventilator tubing and ambu bag. So this is the proximal end. I write it. This is the proximal end. And the middle one, this middle part is called the central part. So this is the central part. This is the central part, and here you can see this is the black line. So what is the purpose of this black line? And there is indications and numbering all over the central part. So I will tell you. So black line indicate the buccal cord guide. It guide the physician the ET tube is inserted into a buccal cord or not, or it is above the buccal cord. So this provide the guidance to the physician. Next is radio opaque line. So ET tube has a radio opaque line. What is radio opaque line? The line that is that will be visible through the X-ray. So after placing the ET tube or inserting the ET tube, we need a chest X-ray to confirm the position of the ET tube. It is placed properly or not. So next is, these are the length indicator, okay, in centimeter, 18, 20, 22, 24. These are the length indicator in the centimeter. So it indicates the physician or nurse to the position of the tube, tube, the fixation uh, and the position of the ET tube, where we fix the ET tube on the length basis. And the ET tube cuff should be 1 to 2 centimeter above the carina. Okay, the carina that divides the trachea into the primary left and right bronchus. So it should be 1 to 2 centimeter above and 2 to 2.5 centimeter below the vocal cord. So this is the exact position of the ET tube cuff. And here you can see this is the ID. What is ID? So this is the internal diameter. So there are so many different sizes of ET tube. So it is measured in a ID. We are going to discuss it later on. So this is the central part, and if the tube is cupped, so this is the cupped tube. So here you can see this is the pilot balloon. This is a pilot balloon. So what is the function of pilot balloon? So it inflates the cuff. This is the cuff. So it used to inflate the cuff. Next is distal end. This is the distal end. This end is a distal end. And this end placed into the trachea. Here you can see the opening. There is a two opening in the middle opening. One is a middle opening and one is a lateral opening. This is if you see, this is the lateral opening, and this is called Murphy eye. This is the Murphy eye. So these are the parts of endotracheal tube. I hope you understand it well. So next is types of ET tube. What are the types of ET tube? So ET tube is divided into two main types. First is cuff tube. And another one is uncuffed. This is an uncuffed tube. So cuff tube is mainly used in adult patients. It is mainly used in an adult patient. It has one cuff and one pilot balloon. But in uncuffed tube, there is no cuff and no pilot balloon. And what is the function of cuff? Cuff function as to prevent the leakage of the air and prevent the patient from aspiration. And this is used in an adult patient, and we have to maintain the 30 mm of Hg pressure in the cuff to inflate this cuff. So we need the 5 to 10 ml of air to inflate the cuff. But in case of uncuffed tube, it is mostly used in children below 10 years of age. And why it used in a children? So the children's subglottis airway is narrow, so it acts as a cup tube. We don't need any cup, or cup can injure the glottis of the patient. So in the children we use uncuffed tube. Next is different sizes of ET tube. What are the sizes of ET tube based on the age group? So in a normal healthy male, the cuff tube we use in a normal healthy male is 8 to 8.5 mm of ID. ID is millimeter of internal diameter. This is the internal diameter. And in normal healthy female, In normal healthy female, we use 7 to 7.5 mm ID2. And in 0 to 6 months child, if the child is in 0 to 6 months, so we use 3 to 3.5 mm ID2. In 6 to 12 months child, we use 3.5 to 4 mm ID2. And in preterm infant, if the baby is preterm, so we use 2.5 mm ID2. These are the size based on age group of the patient. We select according to the age group. So thank you very much for your listening, and you can give me feedback in a comment section. Thank you once again.